Hi, I'm Kurt Egerbrecht. I'm the health officer for the city of Appleton, and I appreciate these question and answer periods that we've been able to share together. Yeah, I think the best communication is always an honest one with our children. And of course, it has to be age appropriate. So I think you have to know your child and where they're at developmentally to know how much detail to actually share with them. But I think every child knows something's not the same. And having that conversation of why, when we go to grandma and grandpa's, do we keep a distance? Or why, when we go to a grocery store, are we staying 6 feet apart and wearing masks? These are all appropriate conversations we should be having with our children and really helping them understand the why behind it. I think what parents can do is really not only explain the virus and what we do know about it, but then being a good role model. So just as they watch us when we put our seatbelts on or wear a bicycle helmet, it's the same thing. We should be role modeling the use of masks, role modeling the social distancing, the things that we know are going to prevent the transmission of this disease. They watch us. They watch us more than they hear us. And so parents modeling the behavior that we want our children to do is very important. In terms of priority testing in our region, we really want to test those who are symptomatic as a priority because those are the people that are having signs and symptoms, and we really need to know if they could spread it to others. So in terms of a priority, those are people who we really want to be tested. A second priority area would be contacts of a known lab confirmed case, because those are people that we know had a direct exposure from someone who is COVID positive. And so we'd really like to get them tested. Thirdly would be people who are asymptomatic or who have no symptoms at all, have no known contact to a case, and yet they have a need to know or a desire to know because of either travel history or just curiosity of whether or not they've been exposed. That's a lower tiered request. And so that might be more difficult to find locations for screening and tests. So those are the ones that are being offered by the National Guard. And if you go into the Department of Health website, those are located on that website throughout the state where you could find testing for asymptomatic people. As we know with diagnostic tests, none of them are 100% accurate, but we know that the research that we're finding, we have a high degree of confidence with the COVID-19 tests that are available in our region. And that is a reason why when we do a test, we also look at signs and symptoms of the illness. So the physician doesn't just rely totally on a test, but also goes with signs and symptoms in terms of advice of isolation or quarantine. So antibody tests are a way of determining if you've had an exposure to a particular virus, in this case, COVID-19. So if you have had a lab confirmed case, you're likely, when tested, to be positive for a buildup of these antibodies, which is the body's defense to fight off the virus. What we don't know and what we need to remember is that immunity that we think we develop through this antibody development may be very short-lived. And research hasn't yet shown us that you have a long-term immunity. So we can't move into the community thinking we don't have to wear a mask or we no longer need to social distance because we can't be contagious again. We can't say that with certainty. In fact, there's evidence quite the opposite, where we believe you could have perhaps a second infection later in time. So that's the limiting factor with having an antibody test, is the interpretation of those results where you think that you could no longer catch the disease or be contagious to others. And that's not yet founded on science. But really, it's that shortness of breath and pain in the chest. Whenever you have shortness of breath or a pain, that's something that you should seek. What we're seeing in younger people, though, in their 20s is sometimes it's confusion, and that's usually caused by a lack of oxygen that is circulating in the blood. So that's another telltale sign that you probably want to seek medical help.